For many years, low-income populations and rural communities all over North Carolina have been faced with increasing concerns about the lack of access to healthy eating options. In North Carolina, the rates of food shortage, food insecurity, and concerns about healthy eating has reached critical levels. National, state, and local policymakers, researchers, and public health professionals have recognized the lack of access to healthy food as an economic, health, and social justice issue. With mounting concerns over rising healthcare costs and limited resources available to address them, we are now faced with what can only be called the epidemic of diet-related chronic illnesses across all segments of the population. With the demise of neighborhood grocery stores and supermarkets, the replacements have been inadequate in providing the fresh fruits, vegetables that are sorely needed by residents seeking to provide healthy and nutritious meals for their families. Many residents don't have the means to travel to grocery stores, which in some cases may be anywhere from 5 to 10 miles away from their home. Unfortunately, communities in this situation face the grim reality of having to shop at convenience stores or eat at fast food restaurants on a daily basis. The consequences of this unhealthy eating lifestyle has had a devastating effect on the health and well-being of low-income minority populations. This, combined with families who live in rural communities, represent a substantial segment of North Carolina's population. Over time, the history of social policies that led to deteriorating environmental conditions, reduced resources for structural improvements, and systems that operated with limited oversight has led to the growing health crisis we face in our community today. Here in North Carolina and across the United States, something truly remarkable is happening. There is a new surge of energy about addressing issues related to access to healthy eating. Farmers markets that accept SNAP EBT, community gardens, and food share programs all offer hope for increasing access to healthy food supplies, particularly for underserved populations. Community partners and neighborhood stakeholders are developing innovative and sustainable solutions that impact large segments of underserved communities. The success of these approaches will have generational consequences for millions of North Carolinians.